Hi, my name is Ayan Lual, and I am the Community Engagement Program Officer at the Center for Migrant, Refugee, and Health. Basically, in today's session, we are going to be talking, about the COVID-19 pandemic and you know um, the COVID-19 pandemic and the vaccination of the COVID-19 vaccine. And, the main reason we're doing this session is, to understand the concerns of youth, like the concerns they may have in regarding to the COVID-19 and the vaccination. First of all, and we have a Tong here. So Tong, I don't know, can we know more about you?
Hi, my name is Adong. Like as she just mentioned, what do what do I need to know about me? I don't have much anyway about myself.
Yeah,
So I
it's
live
okay.
in Melbourne.
Yeah.
Because I also do
Okay.
nothing. Yeah.
So where
So
do
much about
you
me.
Okay, so where do
Mm.
you work, study?
So I work as Australia Force. So
Okay,
I don't study. I finished like in 2019. So yeah.
okay,
So I just
okay.
do work now and just at home.
Yeah, and how has it been working there? Like the experience?
Just working there. I just started it recently, so it hasn't been that too much bad. But yeah, anyway, mostly it's to do with physical work, physical
Okay.
work.
Yeah.
But I don't mind it. It's okay because I
Okay.
don't do any exercise, so that can be just like so it's my exercise as well as just work. So
Yeah, that's all right.
so it's pretty good. So it's
Okay.
okay.
Okay. Yeah. As I said before, I'm the community engagement program coordinator at Center of Migrant, Refugee, and Health. So Yeah. So we're going to get into the topic, to talk about the COVID-19 experiences, and, to share our experiences with COVID-19 and especially with the vaccination and to understand, the concerns of the youth within Victoria, like about the COVID vaccine. So Atong, like, how have your experiences been, like with the whole COVID-19 pandemic situation and the
Mm.
vaccination?
Yeah, it's the when it started. So it has been a tough experience. Just with all the lockdown in happening in Melbourne, I believe we got the harshest lockdown around the world. So
Yeah.
just, but it's been hard just staying inside.
Yeah.
So it's difficult. But what definitely I think maybe I always look for the positive side of things.
Yeah.
So one thing I've discovered is like way before COVID-19, I was like, oh, I need to sleep in. I need to stay at home
Yeah.
and just sleep in for the whole day or maybe a week. And
Yeah.
I got
Mhm.
that one 2020. So I'm
Yeah.
like, now it's just like, yeah, I don't think I want to do that one again. So that's
Yeah.
one thing I pick up on that.
Yeah.
Um, to comment about the vaccine, um, the vaccine, I was like, I was taking hesitant to take it, but
Yeah.
because yeah, not because of I was because the vaccine just been developed and everything. It hasn't been for that long. That was my main concern. So yeah, I
Yeah.
was like, so I was like taking my time before it was made, compulsory to have it at work.
Yeah.
So I wanted to take my time, and
Yeah.
then more studies can come out. Like so, and then they can improve it, or maybe like a little bit, especially with AstraZeneca.
Yeah.
So when they had it and then there was like blood clotting, so it was that one was like it's scary.
Yeah. That
So
would have been scary. Yeah.
yeah, that one was like it's like okay, I will take my chances with COVID 19.
Okay.
Yeah, but then because we have Pfizer, so all of them have more than they have risk anyways. So, but I was on the other side. I wanted to take my time, but then I was like, okay, I don't have time. I want to work. I want to do things. I want to go to the restaurant.
Yeah.
So yeah, it's
So you were
tough.
able to get the COVID vaccination?
Yeah, I got it. Yeah,
Okay.
I
Okay,
just like
that's good.
just
Yeah.
with it.
Yeah. And how prepared are you to live with COVID-19? Like,
I
so
think I'm used to it by now. Like there's no way. Like I think I don't. To me myself, there's no way but to accept it, to live with it, and say if
yeah,
you have to do all the necessary stuff to live with it. Say like say if you have to wear a mask at work, seem like
yeah,
I have no complaint about that. I just wear it.
yeah.
So if say we're in lockdown, yeah, I'll do lockdown. The little kid, your daughter, yeah.
I am so sorry about that. Yeah. So
It's okay. It's a little,
yeah.
yeah, that's all right.
Okay. Yeah.
So
So
yeah, there's not much we can do anyway. Like I mean, like but we have to live with it, and then follow all the measures in place, to prevent like the spread of it. So
yeah.
yeah, so I just follow like follow the rules and
Yeah.
suggestions. So yeah.
Yeah. Okay. And yeah, yeah, also like, with my experiences with the COVID-19, the whole situation, like it had been tough, like especially with the lockdowns and all that. And even with the vaccination side, I was a bit, hesitant, but at the end of the day, ended up taking the vaccination, like, just to protect myself and the community. So yeah, the main reason, we want to get people to to encourage those who haven't been vaccinated, like to get their vaccine. And basically I'm going to also share some information here, like about the COVID vaccination, and so that other youths and other youths within Victoria like would understand more of the COVID vaccination, like since there have been a lot of myths going on or
Mm,
misinformation about the COVID vaccination.
yeah.
Yep. So as I said before, I'm the Community Engagement Program Coordinator at Centre of Migrant, Refugee and Health. I would also like to, include like the services that Centre for Migrant, Refugee and Health provide. So, part of the services that we provide include COVID-19 program real-time dissemination of appropriate information designed by the Australian Government and the Victorian State Government under the Department of Health to fight COVID-19, public health emergency of community concern. So we do this in partnership with funding partners. And first, we would like to acknowledge the Federation of Ethnic Communities, Councils of Australia, who funded the HealthChats program tailored for the young people in Victoria. So basically, this program is done under the HealthChats, and it has been funded by yeah, they had funded the HealthChats, and for just so that we could provide this information more like to the youths within Victoria. So you know in our time, like it is unfortunate to mention that COVID-19 is gonna live with us. But how prepared are you to live with COVID-19? I know I'm prepared, and I hope other youths are also, and other youths within the community are. I hope they are prepared also, to live with the COVID-19. So, sorry, Tong, I'm just going to read out this information, and like just feel free if you have any questions, like in regards to the information that I'm going to be, giving out. Like, just feel free to ask me any questions. Yeah.
No
Yep.
one. Yeah.
Okay. So we may not have the right answers for you, but you can also dispute the information we are going to provide to you. So we suggest the only way we should live with COVID-19 is to adhere to the public health measures, including the observation of the restrictions, isolation, quarantine, hygiene, and getting tested whenever there is an onset of symptoms. In addition, the only scientific breakthrough COVID-19 vaccines. So if you are a young person, we do not want you to take risk. So almost 90% of the people, within Victoria have been vaccinated. And yeah, we want to understand where do these, from the 90%, where do they fall? Like from the 90%, where do they fall? Like the youths that have been vaccinated or have not been vaccinated. So yeah, we don't also want the youths to be a victim of COVID-19 because COVID-19 is real. And, I have heard some myths where people think COVID-19 isn't real. So, Atong, I'm just going to ask you some question. Like, what are the myths or misinformation, like, have you heard about COVID-19?
Oh, just the same, like the one you just mentioned before, like it's not real.
Yeah,
And so, and it's just like, it just like maybe, so some people believe that they can, they're young and that they can fight
yeah,
it off. They
yeah,
can, yeah, they can survive it.
yeah.
So that's pretty much what I've heard. Yeah.
Yeah, and it is true. Like there are, some youths, that are able to fight it off and, and survive the COVID-19. But it's also unfortunate that, that there is also a number of some young people that have died from COVID-19.
Yeah.
So, yeah, so that's why we really, like want to pass out this information and yeah, just to bring more, awareness so they can be more aware and, yeah. So,
I think
so
there's more. I think there's more misconception regarding the
yeah,
vaccine more than the COVID itself, anyway.
yeah, yeah,
But
that's true. So, COVID-19 is mutating every time. You might be left behind, like with thinking whether it is okay to get vaccinated. It is time for for the youths or for the young people within Victoria who haven't got vaccinated to get vaccinated. To save the lives of themselves and many other people living within the community. So the Victorian and federal government has made it easier for people to get vaccinated through pop-up clinics, making appointments with your GP, or visiting vaccination centers. So yeah, so Tong, I also wanted to know like what are your concerns about the COVID vaccine? Like, did you have any concerns?
yeah, the it's pretty much like the side effects on it. But
Yeah,
regarding that, like it's because say they can have like permanent one like side
yeah,
effects. So that's what more scary than that, especially with
yeah,
AstraZeneca before. I
yeah,
haven't looked into like I didn't know like the side effect of it, but like I haven't looked at the list of it.
yeah,
Because I'm like I don't before I just took it. I'm like I'm not gonna look at the list of the
yeah,
side effect of it. Probably when maybe when I was getting reaction like so a little bit like so then I was doing like Google search and
yeah.
I
What sort of reactions did you get from the COVID vaccination?
yeah it's just like some part like headache like maybe that go on maybe like about under 5 minutes. So
Yeah,
that that was decided just getting headache every now and then but like it just come slightly and go so
yeah,
but the nurse they explain it like what will happen and all of that
yeah,
so and they just say like the normal reaction to it and then after that they go say
yeah, yeah, yeah. Yeah, and it all depends on the individual person because
yeah
some people have experienced severe side effects from the COVID vaccine, which even include them having fever,
yeah
headaches, chills, and like feeling really sick, while
yeah
others did not experience
yeah
anything at all.
yeah
Yeah, so like with me also like with my vaccination, like I didn't have many of the symptoms apart from the headache and the sore arm, and that
yeah
was
yeah
the same. Yeah, for the both vaccinations. So yeah, so yeah, we do have many resources that can keep people informed of where to get vaccination, and they can visit the Center of Migrant Refugee and Health. website. That is www.cmrh.org.au/COVID-19. And, they can be able to find more information there, about the COVID-19. So yeah, we do encourage, all people, all youth, all other people that haven't been vaccinated, to get vaccinated and to keep themselves safe and their families and the community safe.
Yeah.
Yeah. So
Probably like, yeah, they're probably like with the side effect maybe. I know like this. I have heard of some like people maybe their any like family members they got like reaction to some side effect to it, so that can
yeah.
like scare people.
Yeah, it
Like
does scare
yeah,
people, yeah. And that's why, like, they do encourage, if you have any severe symptoms or from the reaction of the COVID-19, like, to call, the immediate COVID-19 hotline or call 000,
yeah,
the ambulance for extra advice. But, all COVID vaccinations are safe. And, yeah, I'm sure they have been, tested and approved. Like they did many clinical testing or trials before they even gave it out to the people.
yeah.
Okay. So, yeah, so this was mainly, the topic of today. And I'm so glad that you, Atong, you were, able to join me today, to discuss this topic. And I do appreciate your time and all that. And yeah, this is all the information we had today to share. And I hope other youths, would, you know, see this information and share it, and also, like learn something from it. So, do you have anything else to say, Tom?
Um, Not so much. I think it's to do with like if the person is ready. So it's probably gonna take time for
Yeah,
some people to take it because like if they're not feeling ready, then they can just take their time and
yeah,
then when they're ready, then they can take it or have a discussion with the doctor.
yeah,
So because like there's some I hear like people they can have like exemption if they have any the doctor will do assessment for that. So
yeah, yeah.
yes, I don't have much to add, but yeah, it's a hard topic because
It
like
is. Yeah, it is.
like it's kind of like individual choice, but at the same time, with the time is running out.
Yeah, it is like like I would say an individual choice. And but yeah, basically, with the vaccinations, like we've stayed indoors for too long, where like we missed out of a lot of stuff,
Yeah,
like because of the pandemic. And yeah, and like if you are to get vaccinated, you would be able, to have many chances to go to work and to to attend other things.
yeah,
Whereby if you're not vaccinated, like you may have that limited choice. Because I remember, like, I went to the GP myself, and before they had to see my my vaccination passport, just to make sure I was double vaccinated before I
yeah,
got before I saw the GP. So yeah, so I've seen some places whereby they want people to be fully vaccinated before they attend those services. And yeah, wouldn't it be nice, to miss out on these stuff of other services just because we're not vaccinated? So that's why we do really want to encourage, the youths within Victoria that haven't gotten vaccinated to get their